Hello and welcome to my PowerPoint presentation, the implications for the use of acceptance and commitment therapy in treating anxiety disorders. Acceptance and commitment therapy, or ACT, is considered to be part of the third wave of behavioral therapies, which involve the basic principles of behaviorism while acknowledging the complexity of human behavior, mainly cognition and language processes. Is a verbally based intervention that utilizes mindfulness techniques to help clients identify the function of harmful private events in order to change behavior. It was developed by Stephen Hayes in the 1990s and has gained popularity over the last 20 years. Anxiety, per the DSM 4th edition, is an umbrella term under which the range of symptoms, including feelings of nervousness, irritability, increased heart rate, and difficulty breathing, among others, is linked to various forms of anxiety disorders, including generalized anxiety disorder, or GAD, social anxiety disorder, or SAD, and post-traumatic stress disorder, or PTSD, and also comorbid anxiety, which refers to multiple diagnoses. Per the National Center for Health Statistics, 37.2% of a sample of American adults reported having symptoms of anxiety. Another study found that 3.1% of the total U.S. population have identified as having been affected by generalized anxiety disorders, but only 43.2% of those people are being treated for it. The foundation of ACT is based on relational frame theory, or RFT. RFT finds that the basis of language and cognition is the ability to build networks of relational frames. This is similar to the idea of stimulus equivalence, reflexivity, transitivity, and symmetry, except for they go into a little deeper process or understanding of the processes in order to account for the complexity of cognition and human behavior. Um, so they expand on reflexivity, transivity, and symmetry with their own terms for each. So mutual entailment is basically like reflexivity, and it denotes bidirectionality between the function of stimuli. Combinatorial entailment is where we start to see derived relations within context. With relational frame theory, there is a focus on how the environment, or on how context is what prompts the behavior, as opposed to just the relations that have been developed. Transformation of stimulus function is contextual, is when contextual stimulus control based on the arbitrary relations that have been developed between stimulus. The relational frame is developed when all the three features are present. So that being mutual entailment, combinatorial entailment, and transformation of stimulus function. A function of one member can alter the function of other members of the frame, and this is important, especially when looking at anxiety or private events. The first reference to what would become an act was called comprehensive distancing. In 1986, Settle and Hayes presented a study which looked at reason-giving behavior and the dysfunctional verbal control associated with the reason-giving behavior. So basically, they looked at participants who would tell what they were telling themselves about their behavior was negative or harmful to their well-being. And so Zettel and Hayes used comprehensive distancing and cognitive behavioral therapy to help the participants be aware of what they were saying to themselves and then use that to change the verbal control of their behavior. They did find that comprehensive distancing was successful in doing this. So basically, Accept Act looks at the context and then the function of the behavior, not so much the topography of the behavior. Functional contextualism is an essential part of ACT, as it helps people, or you're looking to focus on the whole event, to the sensitivity of the role and context and understanding the function of the event, the truth criterion associated with the event, and specific scientific goals to help to apply to that truth criterion. Behavioral inflexibility are is what they called it in Cooper. Hayes refers to it as psychological inflexibility and flexibility. But this is the idea that that interference of private events with well-being behaviors can be harmful if they're inflexible. So what ACT looks is to move cognitive processes in learning from inflexibility to flexibility. Cognitive fusion just explains why behavioral inflexibility is so much of an issue. So pretty much, the harder you fight your thoughts or you fight what you're thinking, the stronger the relationship that develops, because you're continuously building to the relational frame network that you have regarding a specific thought or behavior or event. And experiential avoidance is escape or avoidance of unpleasant and private events or human experience. This is key when talking about anxiety, because basically the behaviors and symptoms around anxiety are experiential avoidance. So the goal of therapists utilizing ACT is to help their clients separate the function of their behavior from the topography of their behavior, and to proceed based on the present contextual stimuli. So they use 6 processes to basically encourage or help their client develop behavioral flexibility. Those are acceptance, cognitive diffusion, being present, self as context, values, and committed action. So with acceptance, they basically try to help the client become actively aware of their private events in order to offset experiential avoidance. The cognitive diffusion process Our techniques challenge the undesirable functions of private events by unraveling the verbal relations that the client has formed for themselves. Being present is presented as a means for individuals to have experience, both covert and overt, but to do so directly in the moment and without judgment. Self as context processes are really involve having a sense of self, as that promotes flexibility in behavior, which is necessary to develop actions in alignment with their true values. When a client is able to solidify self as context, this allows for the perspective of detachment from relational frames that hinders proactive behavior. Values are important in an important process just because helping an individual establish clarity regarding their values provides purpose for their life direction and serves as the momentary motivating operation for desired behavior. And the final process is committed to action. At this point, the individual's concrete behavior change goals are developed between the client and the therapist, and this at this point is when they basically put to use what they have learned in their environment. Here we have two diagrams that provide a visual display of psychological inflexibility and psychological flexibility. So basically, psychological inflexibility is where many people, especially those with anxiety, find themselves. Um, that's the cognitive processes they're constantly stuck in, and that maintain their behavior related to their anxiety. And then on the other side, we have flexible psychological flexibility, which is where ACT tries to help clients find their state of mind or move their state of mind. So each point of the diagram correlates to a point in the opposite diagram. So acceptance in the psychological flexibility diagram is the process used to overcome experiential avoidance. Diffusion is the process used to overcome cognitive fusion. The different processes can be grouped into commitment and behavior change processes, or mindfulness and acceptance processes. The mindfulness and acceptance processes involve acceptance, diffusion, contact with the present moment, and self as context. And these are basically the behavioral definition for mindfulness. And the other group is the contact with the present moment, self as context, values, and committed action. So that's when you start to put it into action, or you really change the behaviors you're looking to change. So these are 3 ACT mindfulness exercises. I'll just briefly explain a bit. So the first one is take 10 breaths. So the therapist would have the client, or as a client, throughout the days to pause and take a moment, take 10 slow deep breaths, focus on their breathing slowly if they can, so the lungs are completely empty and then completely full. To notice the sensation of their lungs emptying and their rib cage falling as they breathe out. Notice the rising and falling of their abdomen. Take notice of what thoughts are passing as they do this. Notice what feelings are passing in their body as they do this. Observe the thoughts and feelings without judgment, without seeing them as good or bad, without trying to change or avoid them. Just stay with them and observe them. And then notice what it's like to observe the thoughts and feelings with acceptance. The next one, floating leaves on a moving stream. The therapist would ask the client to imagine a beautiful, slow moving stream. Imagine the water, the rocks, the trees, the hills, and as the water travels through a valley, notice leaf drops down into the stream and how they float away down the river. Imagine sitting beside that stream on a warm, sunny day, watching the leaves float by. Then be conscious of their thoughts. Each time a thought pops into their head, imagine writing that in one of those leaves. If they think in words, they can put them on the leaf as words. If they imagine images, they can put the image on the leaf. The goal is to stay beside the stream and don't allow the leaves on the stream to keep flowing by. And to allow the leaves on the stream to keep flowing by. Don't try to control the stream. Don't try to make it go faster or slower. Don't try to change what shows up on the leaves. If the leaves disappear or if they mentally go somewhere else, just continue to focus on the stream and let it happen. And then they're to file the knowledge away and return to the stream anytime they need to do so. And the last one is meditation on the soles of their feet. So they're supposed to stand, and or it's basically used for aggression. So if somebody is in an aggressive posture, put the soles of their feet flat on the floor. If they're sitting, just put the soles of the feet flat on the floor. Breathe naturally and do nothing. Then cast their thoughts back to an incident that made them very angry and stay with that anger. If they're feeling angry and angry thoughts are flowing through their mind, let them flow naturally without restriction. Stay with the anger. Then shift all the attention fully to the soles of their feet. Move slowly their toes. Feel their shoes covering their feet. Feel the texture of their socks, the curve of their arch, and the heels of their feet against the back of their shoes. If they don't have on shoes, they can just feel the floor, the carpet with the soles of their feet. They keep breathing naturally and keep focus on the soles of their feet until they feel calm. And then they're to practice this mindful exercise anytime they begin to feel or an incident comes up that reminds them of their aggression. And then once they're calm, they can walk away from incidents or situations with a smile because they control their anger. An article that is relevant definitely to us in our class is Acceptance and Commitment Training, Art Therapy Act, a method that applied behavior analysts can and should use, by Dixon and his colleagues, and it was released in the 2020 Psychological Record. So basically, Dixon used the 7 dimensions of behavior analysis and compared them to ACT to see if it met the 7 dimensions, and they found that it did. So of course, the 7 dimensions are applied, behavioral, analytic, effective, technological, conceptually systematic, and generality. As far as applied, they did find that it's socially significant, um, particularly due to the social validity questionnaires that are often required of patients or clients that are receiving ACT therapy. It's meant to be behavioral dimension as it's specific to verbal behavior. It is analytic in that the variation in the time necessary for active is of concern, but there have been many studies that use single subject and multiple baseline design to show functional relationships. As effective as it is used for a variety of different issues from task performance to addiction, pain tolerance, pornography, anxiety, among others. It is technological due to procedures. So it's a little hard to replicate ACT interventions just because the nature of the therapy is so individualized and specific to the particular person. But there are lately they have been trying to come up with more concrete procedures to implement if needed. It's conceptually systematic in that many of the bases of ACT is to look at derived relations and how reinforcement maintains the derived relations. And clearly, the ultimate goal of ACT is for what the clients learn during sessions to be able to generalize to new environments. And there have been studies that have found that the effects of ACT can be maintained over long periods of time and also seen in other parts of participants' lives. The avoidance aspect of anxiety and anxiety disorders is what ties the disorder to behavior analysis. Diamond and Roche in 2009 examined anxiety from a behavioral analytic perspective. They acknowledged that anxiety does cover a wide range of disorders, but there is still the aspect of avoidance. Um, of course, there has been a lot of research on avoidance in behavior analysis, including shock avoidance and the two-factor theory experiments by Herrnstein and Heinlein. But they do not account for the maintenance of avoidance and the absence of the aversive stimulus. So it is the association of derived relational responding and avoidance that maintains anxiety in those that experience it. And it also is what allows, or this focus on derived relational responding is where ACT comes in and is able to provide intervention for this disorder. Below are two studies that focused on ACT and anxiety. The first one is by Wadnick, Morrison, and Tuhig, Twag, in 2014, and their study was based on post-traumatic stress disorder. So what they did, they had 7 teenagers. 4 were from a residential facility, or I'm sorry, community sample, and then 3 were from a residential community, a residential home, and they recruited the teenagers. They had them at intake. They did questionnaires and surveys to assure that they were acceptable in their symptoms of PTSD. After intake, a multiple baseline report or study was conducted. They used self-reporting throughout the study by the teenagers as data for throughout the study, and then they did a post-treatment survey questionnaire and then a follow-up afterwards. The results of the study were a decrease of 69% of symptoms for the community participants and 81% decrease for the residential participants. And then at follow-up, which was 3 months later, there was a 68% decrease of symptoms maintained for the community participants and an 84% reduction in symptoms for the residential participants. The next study was in 2007 by Darl Dalrymple and Herbert. And they were looking at social anxiety disorder, or SAD. They had 19 adults participate in a study to observe the effects of ACT on SAD. At intake, they used survey data, self-reported questionnaires to serve as baseline, and then they implemented a 10-week ACT training once per week, and at the end of the treatment, they had post-treatment surveys and then follow-up surveys. The graph is of one of the surveys used, the Leibowitz Social Anxiety Scale, and it shows a decrease in symptoms from pre-treatment throughout follow-up. So there are, of course, limitations when it comes to looking at anxiety from a behavioral analytic perspective, and so trying to see how ACT can be effective when it comes to anxiety from a behavior analytic standpoint, there are some barriers, including private events, research design, and the competency level of the therapist. So regarding private events, as anxiety, much of the verbal behavior goes on within the skin, it is, of course, hard to gain any observable measures for anxiety. A lot of the studies use self-reporting surveys and questionnaires as their data, which is hard for many traditional behavior analysis to stand behind. So a possible solution to this would be to try to target any observable behaviors the clients may have in association with their anxiety, and focus on that for research. Another issue is research design. Um, Again, much of or many of the studies use surveys and questionnaires, so it's hard to any um, to show function based on reversing um, phases as we generally see in behavior analysis. Um, and also ACT, in order for it to be effective, takes time. So most of the studies, they implemented ACT for 9-10 weeks before they took any post-intervention data. So that serves as another barrier in their research. And lastly is competency. Of course, in standing with the BACB, behavior analysts should not act or should not implement any procedures outside of their competency. And due to the wide range of others that um, implement ACT, there's a lot of pushback from ABA professionals to gain the competency necessary to um, put the intervention into place. And that is the end of my presentation. Thank you for your time.